Hi, my name is Laura Chadsey. I am currently a rotating intern at the Animal Medical Center in New York City. I'm interested in pursuing a residency in veterinary medical oncology. This is a project that I completed while in veterinary school at The Ohio State University. We looked at the clinical outcomes of 3 cats with indolent cutaneous T-cell lymphoma treated with hypofractionated radiation therapy. Cutaneous indolent T-cell lymphoma, or ICL, was previously referred to as cutaneous lymphocytosis. It is a rare, slowly progressive lymphoproliferative neoplasia. There are currently no standardized protocols for the treatment and management of ICL in cats. Reported treatments include surgical excision, antibiotics, systemic, topical, and intralesional glucocorticoids, and chemotherapeutic agents. In humans, radiation has been shown to effectively treat cutaneous lymphomas and other round cell tumors. This case series includes 3 cats diagnosed with ICL via histopathology and confirmed using immunohistochemistry and PCR for antigen receptor rearrangement, or PAR. Cat 1 was a 17-year-old male castrated domestic shorthair with a lesion on his left lateral thorax characterized by pruritus, erythema, alopecia, mild edema, scaling, and excoriations. Cat 2 was a 12-year-old female spayed Siamese with a lesion on the left scapula and cranial thorax characterized by mild edema, hypotrichosis, and erythema. Cat 3 was a 12-year-old male castrated Maine Coon with a lesion on the dorsal aspect of his head and neck, characterized by pruritus, erythema, alopecia, crusting, erosions, ulcerations, and scaling. All cats were previously refractory to systemic glucocorticoid administration. Cat 3 remained on oral glucocorticoids throughout the treatment. All cats were treated with hypofractionated radiation, consisting of 4 fractions of 8 gray, for a total dose of 32 gray over 21 days. Figure 1 displays the histopathology of skin lesions stained with H&E at the start of radiation and approximately 5 months after initiation of radiation. Prior to radiation, lesions were histologically described as having diffuse infiltration of the dermis with CD3 positive T cells. Molecular clonality analysis revealed clonal T cell receptor gamma gene rearrangement. Post-radiation biopsies from Cat 1 had no evidence of neoplastic disease within the sections examined. Post-radiation biopsies from Cat 2 had a marked reduction in dermal lymphocyte infiltration, although nodular areas of neoplastic lymphocytes persisted within the deep dermis and panniculus. Post-radiation biopsies from Cat 3 had similar lymphocytic infiltration to the initial biopsies. However, the lymphocytic infiltrate was present within only the deeper dermis and subcutis, with mild granulomatous inflammation interspersed throughout. PAR was repeated on all post-treatment biopsy samples, and identical clonal rearrangements of T-cell receptor genes were detected. Figure 2 displays the skin lesions prior to and after radiation therapy. Cat 1 was determined to have complete clinical response to radiation, characterized by resolution of erythema, edema, pruritus, with hair regrowth. Cat 2 had partial clinical response defined by resolution of erythema and hair regrowth. Cat 3 had partial clinical response to treatment defined by resolution of erythema, crusting, and ulcerations. However, Cat 3 developed progressive disease 202 days after radiation with skin lesions including pruritus and ulcerations. No cats had clinically relevant adverse events secondary to radiation aside from leukotrichia. A modified version of the AVMA Palliative Radiation Satisfaction Survey was provided to owners to obtain owner satisfaction and quality of life assessments. All owners were very satisfied with treatment and reported significantly improved quality of life in their cats. All cats had reportedly increased comfort and improved clinical signs. In the present study, both gross and histologic improvements were observed after radiation. Despite the absence of complete histologic remission, all cats had positive clinical response and had greatly improved quality of life after radiation. Factors such as time to diagnosis, location, type, and size of lesion may impact the success of RT and warrant further investigation. I would like to thank my co-authors, Drs. Diaz, Kisseberth, Cook, Green, Jennings, Vernau, and Moore for their contributions to this project. I will be answering any questions through the chat function on the conference platform or through the direct message function. Thank you.